Hello, everyone. Welcome to another exciting episode of EdTalk World. This is your host, Krish Basra today. Today, we have the privilege of speaking with Dr. Dre Barad. Dre Barad is a cross-trained expert in epidemiology, pharmacopedemiology, and genetics. She holds position at the University of Montreal, CHU Saint-Justin, and the Université Claude Bernard in Lyon, France. As a Canada Research Chair Tier 1 holder and director of various research initiatives, her work focuses more on medications, pregnancies, and child health. With over 500 publications and $37 million in funding, Dr. Barad contributions have been recognized with prestigious awards. She also serves on the Scientific and Ethics Committee of the Cohort Marianne in France. So without any further ado, allow me to introduce her to all of you. Welcome, Dr. Barad, to EdTalk World. How are you doing today?
I'm very good. Thank you for the invitation.
Dr. Barad, before we commence today's session, I would like to thank you for taking your valuable time today and joining us.
My pleasure.
All right. So to begin with, Dr. Barad, could you please share how technology has transformed education in recent years and what trends do you see emerging in the future?
Well, nowadays it's difficult. Of course, I'm in the postgraduate sector, but it's difficult to teach without a computer nowadays, without internet, without ebooks. So obviously we are in this reality right now. We even have electronic exams. So paper copies of almost everything is out, and we are clearly in the electronic age. Once the pandemic started, it even became more apparent that we needed the technology to continue dispensing courses, teachings, conferences, even research for that matter. So we are now in the virtual world. This is how we're talking together today. So it is essential. It is essential for multiple reasons. Now with the, I speak to you in English right now, but if someone would not understand English, they can actually have change the setting of our video and put it in any language that they wish for. So they would have subheadings. So it reaches a far greater population than just you and I in English today. And that is true with regards to equity, diversity, inclusions. We hear that a lot and we're not quite sure what it means many times. But basically what it means is that we have to be able to give in our field, we have to be able to reach out to multiple populations that cannot come in person to actually attend the class or even see a podcast or hear a podcast. So those who are, underserved population, we call them, although I don't like the terms, but those who live far away, rural, remote areas. And Canada, where I live, is a very big country, but it's difficult to reach everywhere. So obviously the virtual world gave us this opportunity. Now we also have social media that is also a great help with regards to, teachings nowadays. It's very good. It disseminates information at the lightest speed. It also disseminates misinformation at the lightest speed, light. So we have to be careful. We have to monitor that, and we have to control this environment, although it's very difficult to do so. Now, for the future, AI tools they're already there. So it's ridiculous to say that I do not allow, for example, ChatGPT to be in my class. It's ridiculous. It's there, and we cannot stop it. We have to deal with it. I think ChatGPT or any other AI tool has the opportunity to actually help teachings in many ways. Obviously, we have to be aware of that as a teacher, a professor, and we have to modify or modulate our activities, our teaching activities, to take that into account. We cannot say it's impossible, not in my classroom, not anymore. It's there, so we have to deal with it. And this is where we're going. AI can help us be more efficient, but also there's also a limitation in doing that, for bad use of it. But we have to be aware of that. This is clearly where we're going.
Exactly. Such an impressive credentials indeed. To move ahead, and since we're discussing more about technology, what do you think, Ms. Virat, that how technologies help bridge the digital divide and ensures that all students have access to the high quality education?
Mhm. I'm going to take, I already mentioned many of my talking points. Technology, we can reach, have a much greater net, so we can disseminate much faster. We can reach more diverse population. We're no longer limited in the language that we speak, because there's translation as subtitles. That in order to do that, we have to have access to computers. We have to have access to Wi-Fi, broadband, to be able to see videos and so forth. And I think certainly in developed countries, we think we're advanced. We are, but we're not advanced equally across ethnicity, across socioeconomic status, and also across place of living. Like I mentioned, Canada is very wide and not everyone has access to internet. And we saw that at the beginning of the pandemic, where it was essential to stay home and continue learning. Some children and some people of higher education as well, in the higher education field, didn't have really good computers, didn't have access to Wi-Fi, very, fast Wi-Fi. So in order to do that, I know it's evolving. I know the pandemic made us realize that internet should be a basic need, given everything,
Exactly.
that was developed in that time. But obviously, this is where the limitation is right now, but I think it's going to be solved, in the coming years, hopefully, because there will be another pandemic. We will be in the situation that we were a couple of years ago. And so we have to be better prepared.
That's remarkable. That's so remarkable, Ms. Barat. Thank you so much for helping us to understand the power of technologies that plays today in education. Proceeding further, could you also please shed some light on what role data and analytics play in the education technology? And how can educators use this information to inform instructional decisions, I would say?
So basically, analytics is essential. And what does analytics do is it evaluates what you're doing, right? It gives you, percentages, number of views, little quizzes. Also, you can do quiz, virtual quiz. So analytics is essential in order for your curriculum to remain relevant. Okay. 30 years ago, we were not teaching the same way, but not all. In addition, we were not teaching the same things, that we are today. It's just, it's evolving. I am in the health field, and it's not an exact science. It's not like math. And therefore, things are evolving. So we, analytics or evaluation, program evaluation, if we want to think this way, is essential because it helps us to keep relevant. And also it helps us to see little pockets where our teachings can be improved. So it is essential. In order to do that, however, we need to have assessment I'm always talking about pre-post.
Mm-hmm.
So we have an intervention in order to know if the intervention I'm sorry, works, we have to have a baseline idea of how things were understood, how things, were taught before we put in place the intervention in order to see if it works, to evaluate it. And it's the same way with all the technologies that actually enter the classroom nowadays. We don't know if it works unless we evaluated how things were comprehended, how things were understood before this new technology was put in place. And many times, new technology, it's like the new shiny thing, the new shiny toys. And we tend to want to put it fast in place without having a baseline evaluation before we're putting it in place. So basically, we put things in place without thinking of the evaluation, and analytics can certainly help us doing that. Of course, analytics is electronic nowadays, but if you're still in a paper and pen mode, there's multiple ways to analyze a new curriculum. Nowadays we are moving towards, peer-to-peer teachings. So basically you see the profs once in a blue moon, just to make sure that everything is understood the same way. But the teachings is really among students, so peer-to-peer. In order for this new methods to evaluate if it works, you have to have indicators that you identify before you measure these indicators, then you put in place your new program, that being virtual or any other program, and then you evaluate it after. The beauty of being virtual like we are today, you'll be able to compare our Ed Talk in terms of viewings and questions, or, to the other Ed Talks that were done before, so you have to have a comparator. And this is why pre-post is so important. But analytics will help us because it's done automatically. So this makes evaluation faster.
Exactly. That's amazing, Ms. Virad. Thank you so much for that. Ms. Virad, one thing that, since we all know that you have a great experience in education, now having the One Health perspective in mind, what is the importance and challenges of interdisciplinary and intersectionality post-secondary education? If you can share some important points on this, I'm sorry.
Sure. University programs are unidirectional, unidiscipline, and this is how it should be. It makes sense. So you're studying to be a biologist or a chemist or an epidemiologist. And of course, you have to learn tools to be a good epidemiologist, a good biologist, a good chemist. So therefore, this is your expertise. But once you finish your course, your program, your diploma in hand, you enter the real world. And there you need transdisciplinary and transsectoriality skills. So you're an expert in a field, but you have to be able to know other fields that are close to yours in order to fully comprehend a problem, an issue. So transsectoriality is essential. I'm going to give you an example. I'm in the field of medications in pregnancy. People study at the graduate level to be an epidemiologist, to be, like I said, a chemist, a psychologist, and so forth. But in order to identify if a medication increases the risk of birth defects, so if a medication is a teratogen, you need multiple skills. You need to know about pharmacoepidemiology, but also pharmacogenomics. You need to know pharmacology, toxicology, and nowadays you need to have AI, machine learning skills. That at the university level that is feeding itself. So One Health is around, everything is feeding to answer one problem. And therefore, at the university, they're not teaching this. So therefore, now we have, so I'm preaching for my choir here, so for my parish. So therefore, now we put in place the Canadian Mother-Child Cohort Learning Program, and that gives virtual courses in many fields, all fields that are required to be able to identify if a drug is a teratogen, increases the risk of a malformation. And that is not given at the university level, but the technology now allows us to put in place curriculums that do address the One Health perspective across sector, across discipline, in order for students, once they enter the real world, to be better equipped to deal with problems. So it is essential to have, other skills other than your main expertise.
That's amazing. Thank you so much, Dr. Bharat, for educating us a lot of, I would say. My final question for you today is, according to you, what is the importance of mentoring and partnership with students? Because many of our educators may face some issues there. And with lived experience to deliver a robust and relevant curriculum, if you can share your points on this.
Well, mentorship is essential. I had mentors when I first started. I started in the academic world, but also while I was a student at the undergrad or graduate level, I always had mentors, people you look up to, people you can knock on their doors to ask questions for everything about life, about work, about, school. So mentorship, now that I'm on the other side of the fence, it's essential, to actually help guide students, new academics. Also in my case, it's essential because you give to the other because you've received, and this is how the world turns. So this is an important thing. Now, with regards to, partnership with students, so we call them, I call this co-creation. So I have a curriculum, I'm teaching in a class, I have an idea of what I want to give, but before starting any class, I ask questions to my audience because I want my class to be appropriate to, I want to engage with the people I have in front of me. Sometimes I have 200 students in front of me, sometimes I have 20, but I want to be, obviously the level of engagement is different depending on the size of the class, but I want to be able to reach them in a way, to talk in a way that it makes sense to them, not to change the topics, obviously, because topics need to be covered, but we can deliver a topic or information on a topic multiple, different ways. So it's important to keep in touch with your audience in order to reach them, for them to maintain the information once the class or the talk is over. So co-creation, partnership with students is essential because it's going to make your curriculum or your course more relevant to them, and it's going to increase the level of information maintenance, so they will keep the information longer, and they'll have a more fun also in your class if it reached them and you find examples that are relevant to them.
Exactly, that's really important. Thank you so much, Dr. Bharat, for sharing your amazing insights and expertise with us today. This has been definitely an enlightening conversation for all of us.
It was my pleasure.
Before we conclude this session for today, for our viewers, thank you so much for watching our session today. Please make sure that you like, share, and subscribe to our YouTube channel because you have a lot coming from us. This is Krish with Dr. Bharat signing off.